Welcome all. Myself, Dr. Karthik, from the Department of Oral Medicine and Radiology, Associate Professor from Vinayaga Mission Sankaracharya Dental College. Today, my lecture is on ulcers of the oral cavity. What you mean by ulcer? An ulcer is defined as a break in continuity of the epithelium brought about by mucosal destruction and is covered by granulation tissue. How to classify the ulcers? The ulcers are classified based on the number, usually as solitary and multiple. Solitary ulcers are usually traumatic ulcers or carcinomatous ulcer. Multiple ulcers are caused by deep-seated fungal infections such as mucormycosis, aspergillosis, blastomycosis, coccidiomycosis, histoplasmosis. Based on the size, ulcers, there are different types of ulcers such as minor aphthous ulcers and major aphthous ulcers. Minor aphthous ulcers are less than 1 centimeter in diameter. Major aphthous ulcers are more than 1 centimeter in diameter. Based on the edges, the ulcers are classified into tuberculous ulcers which have characteristic undermined edges. Syphilitic ulcers usually have punched out margins. Traumatic ulcers have a sloping edge. Rodent ulcer or basal cell carcinoma have a rolled out and everted margin and appear pearly beaded like. Based on the durations, the ulcers are classified as acute and chronic. Under acute, there are acute solitary ulcers and acute multiple ulcers. Under chronic ulcers, they are classified as chronic solitary ulcers, chronic multiple ulcers. For examples of acute solitary ulcers include traumatic ulcers and necrotizing xylometaplasia. This mimic malignancy. Acute multiple ulcers, herpes zoster, erythema multiforme, chemotherapy-induced ulcers, hand-foot mouth disease. Solitary ulcers are carcinomatous ulcer, fungal infections such as mucormycosis. The chronic multiple ulcers are usually pemphigus and pemphigoid lesions. There are some recurrent ulcers. Usually, aphthous ulcers can be recurrent in nature. Herpes-induced erythema multiforme and cyclic neutropenia, an autoimmune disease called Behçet's disease, usually are recurrent in nature. Based on the presence of infections, according to the etiological agents such as bacterial, viral, and fungal. Under bacterial infections such as tuberculosis, which is caused by Mycobacterium tuberculosis, a tuberculous ulcer is of bacterial origin. ANAG is caused by Borrelia mensantae and Fusobacterium fusiformis. Viral induced ulcers are herpes zoster caused by varicella zoster virus, HSV1 and 2 induced erythema multiforme, and herpangina, which causes by Coxsackie virus. Fungal infections such as mucormycosis, also called the black fungus, coccidiomycosis caused by Histoplasma capsulatum, and blastomycosis caused by Blastomyces dermatitis. All are called deep-seated fungal infections which can induce ulcers in the oral cavity. Based on the absence of infections, the ulcers are classified as non-infectious ulcers, autoimmune, ulcerative lichen planus, pemphigus, pemphigoid, Behçet's disease, and vaginous granulomatosis. This is a classical picture of a traumatic ulcer which occurs usually on the lateral border of the tongue, caused by a sharp broken carious tooth or clasp of the ill-fitting processes. The edges of the ulcers are sloping and they have a pinkish granulation tissue. The surrounding ulcers are usually whitish due to friction. The tuberculous ulcers are caused by Mycobacterium tuberculosis. They are very rare. Usually such patients have weight loss, chronic cough, and evening rise of temperature. They have a characteristic undermined edges. Mucormycosis is also caused by black fungus, Mucorales species, usually seen in uncontrolled diabetes greater than 300 mg per deciliter or poorly controlled glycosylated hemoglobin more than 8. Such ulcers caused by mucormycosis are solitary, where you can see an exposed necrotic discolored alveolar bone associated with space infections. The treatment is mainly Systemic antifungal agents such as intravenous amphotericin at a dose rate of 1 to 1.5 mg per kilogram body weight. Posaconazole and voriconazole are used as salvage therapy in the treatment of mucormycosis. The dosage of posaconazole is about 100 mg once daily and voriconazole 200 mg every 12 hours. Ulcer caused by histoplasmosis is mainly caused by fungus, Histoplasma capsulatum. They are excreted among the PG and excreta. Ulcers involve the buccal mucosa, gingiva, tongue, lips. They have fever, headache, anorexia. Chiefly affects the reticuloendothelial system such as the liver, spleen, resulting in hepatomegaly, splenomegaly. The disseminated histoplasmosis are characterized by multiple ulcers in the oral cavity. They usually respond to antifungal therapy. Coccidiomycosis is another deep-seated fungal infection caused by Cryptococcus neoformans. It causes first widespread lesions, multiple brown papules in the skin, and non-specific ulcers that can be mistaken for leukemia. Histopathology, budding yeast-like gram-positive cell with characteristic halo can be seen under histopathology. Blastomycosis is caused by Blastomyces dermatitis. The South American form and North American form are the two forms of blastomycosis. The South American forms, the microorganisms are larger, of 10 to 60 micron in diameter than the North Indian forms. They can penetrate deeper after the extraction of tooth. The oral lesions can resemble epidermoid carcinoma. Begin as small red papules affecting the skin, gradually from miliary pustules or abscess with discharge by sinus, usually associated with fever and weight loss, such as in tuberculosis. Treatment is mainly systemic antifungal drugs intravenously, amphotericin B, which can cross the blood-brain barrier. They are given at a dose rate of 0.7 to 1 mg per kilogram body weight. Other systemic antifungal therapies include itraconazole at a dose of 200 to 400 mg daily for 6 to 12 months, fluconazole 800 mg daily for 6 to 12 months, voriconazole 200 to 400 mg for 6 to 12 months. Erythema multiforme is triggered by medications such as analgesic like acetaminophen, oxycam derivatives like piroxicam, antiepileptics like phenytoin valproic acid, antibiotics such as penicillin, aminopenicillin, tetracycline, erythromycin, sulfonamides, fluoroquinolones, cephalosporins. Any antibiotic can trigger erythema multiforme. This is a case of erythema multiforme that was triggered by amoxicillin, which is prescribed commonly in dental infections. The viral lesions HSV1 and HSV2 can induce erythema multiforme. They are characterized by hemorrhagic crusting on the vermilion border of the lips. Also, they have a target or bull-eye lesions usually present on the palms and soles. Herpangina, the main etiological agent is Coxsackie virus of A subtype 16, 22, 12, 1 to 10 and Coxsackie B virus, Ecovirus 18 and 71. They usually present as multiple discrete ulcers involving the soft palate, facial pillars, uvula. Children under 10 years are usually affected. It is usually a self-limiting disease. The management is directed towards control of pain and fever. Ulcerative lichen planus is a T-cell autoimmune mediated disorder characterized by cotton fluffy white appearances along with ulcers. They are also characterized by pruritic dermal lesions on the extensor aspect of the palms and soles. Pemphigus vulgaris is another autoimmune disorder that affects the desmosomal glycoproteins, namely the desmoglein 1 and 3, which are targeted in the oral mucosa and the skin. It's a chronic autoimmune disorder characterized by blister formation, which easily ruptures due to the flaccid bullae that occurs on the skin and ruptures to form ulcers. They are usually multiple in ulcer, usually affects the buccal mucosa. Treatment is mainly aimed at steroids, Vizolone, prednisolone, given at the dosage of 1 mg per kilogram body weight. Pulse therapy such as intravenous methyl prednisolone. The methyl substituted prednisolone can be given for treatment of pemphigus vulgaris. Other immunosuppressants such as mycophenolate mofetil 300 mg twice daily and azathioprine 100 mg once daily can be given as immunosuppressant therapy, the treatment of pemphigus vulgaris. Aphthous ulcers types, they are classified as minor aphthous ulcer, major aphthous ulcer, and herpetiform ulcers. The minor and major are differ by the size, which is less than 1 centimeter minor aphthous ulcer, more than 1 centimeter in diameter major aphthous ulcer. A Sutton's disease is characterized by major aphthous ulcer. Usually scarring is present in major aphthous ulcer and they are absent in minor and herpetiform ulcers. Recurrent aphthous ulcer are usually caused by iron and vitamin B12 or folic acid deficiencies. They occur multiple on mobile non-keratinized mucosa such as the labial buccal mucosa, ventral surface of the tongue, floor of the mouth, mucogingival junction. They are surrounded by characteristic erythematous halo with yellowish base. Herpes labialis. The extreme summer cold or hormonal changes can induce herpes labialis, characterized by multiple discrete ulcers involving the vermilion border of the lip, usually ipsilateral same side, not crossing the midline. Topical treatment is aimed at giving acyclovir, 5% acyclovir, an antiviral drug given topically in gel form under the trade name Zovirax. Such patients should be deferred from any dental treatment such as scaling to prevent aerosolization of the virus. Herpes zoster is caused by reactivation of the varicella zoster viral infections or as a primary infection from chickenpox during the childhood days. The virus remains dormant along the trigeminal ganglion and it spreads along the distribution of the dermatome caused by the trigeminal nerve. When the ophthalmic division is affected, they usually result in conjunctivitis or ocular paresis, even blindness. Hence, such lesions should be treated aggressively without any delay. The maxillary division is affected, the ala of the nose, skin of the upper lip, gingiva, the maxilla, usually on one side, affected. Such ulcers never cross the midline. That gives a clue for your diagnosis. So, in this case, we can see the scarring induced by the herpes zoster ulcers. Usually the scarring is seen midline, not crossing the opposite side. The mandibular division is affected. The tip of the chin, skin of the chin, gingiva involving that part of the mandible are affected. Acute necrotizing ulcerative gingivitis called as ANAG. The main etiology is Spirochetes fucibacterium fusiformis and Borrelia vincenti, characterized by punched out ulcers in the interdental papilla. Such patients have halitosis and metallic taste. Eosinophilic ulcer, traumatic ulcerative granuloma with stromal eosinophilia, also abbreviated as TUCSE. The etiology is unclear and still controversial. Trauma is afflicted in some cases, usually affect 40 to 60 years. They appear solitary, rolled, elevated borders and can mimic as a carcinomatous ulcer. Carcinomatous ulcers usually have a etiology of chronic chewing or chewless form of tobacco. Sometimes it can also be induced by human papillomavirus without the habits, or a sharp carious tooth or ill-fitting clasp of the dentures. The ulcers do not heal for more than a month. The ulcers are irregular in shape. They have everted margins, necrotic and indurated base. The patients may also give history of avulsion of the tooth during brushing their teeth. Carcinomatous ulcers also bleed spontaneously. Cyclic neutropenia is an immunodeficiency syndrome characterized by regular periodic oscillations in the neutrophil count from normal to neutropenia levels every 21 days, lasting for 3 to 6 days. Such patients suffer from fever and gingivitis. Severe periodontal destruction are also seen in such patients, mimicking aggressive periodontitis. Some of the drugs that can induce multiple ovular ulcers includes bisphosphonates such as alendronate, chemotherapeutic drugs such as cisplatin, methotrexate, antihypertensive such as nicorandil, antirheumatic drugs such as indomethacin can also induce ulcers in the oral cavity. Behçet's disease is an autoimmune disorder characterized by small and medium-sized vasculitis. Age 20 to 30 years, they are characterized by triad of recurrent aphthous-like ulcers along with genital ulcers, oral ulcers resulting in uveitis or retinal vasculitis. Vaginous granulomatosis is another autoimmune disorder affecting the small and medium-sized vessels. It is characterized by strawberry gums, resulting in gingival enlargement. Patients have glomerulonephritis, fever, cough, pain in the sinus, joint aches, and blood in the urine. Hematuria also the patient may complain of. Thank you.